Well, Pat, during a pandemic, it is EMS. It is our EMTs and our paramedics who are the first line of defense against the spread of infectious diseases. I mean, they are the first ones to provide medical care in an emergency, and they're also the ones who are identifying who might be carrying infectious diseases and report that information to hospitals, helping to stop the spread of diseases. But right now, EMS facing some huge obstacles and a small window of opportunity to overcome them.
If there is one thing we know for sure about COVID-19 is it is unprecedented.
This is something that we've never dealt with before. And you know, we're feeling this nationwide.
Roger Hooper is the chief fire administrator for York County.
Trying to make preparations as we go along has been challenging.
Right now, their biggest problem is a lack of personal protective equipment, masks, gowns, and eye protection.
You know, we just hope we're going to get things in place in time before things get a little dicier.
COVID-19 has forced the EMS system to change protocols. 911 dispatchers are now asking callers COVID-19 related questions about symptoms and travel to better determine what first responders are walking into.
It is not at the Ebola level, but it is, we're trying to protect the patient. We're trying to protect our provider.
John Brady is the division chief at Kennebunk Fire Rescue.
We are doing well right now, but there could be a point in time where our levels of service could be reduced just based on people getting sick.
And that could be devastating for an industry already suffering from a staffing shortage.
You know, one provider going out can actually have an impact on several communities. When this is over, we need to have some long, serious conversations about how we're going to fix this.
In the meantime,
every day we screen each other twice a day in-house, and just go and do the best we can with what we have.
Now, both EMS officials that you just heard from say they have been watching the numbers of cases continue to grow, and they've been just waiting for sort of that big wave to come their way to York County, and it looks like that is on its way. According to the CDC director today at his briefing, and Pat, you mentioned this earlier in the newscast, there are 27 cases now in York County, making them the second highest county as far as positive cases of COVID-19 next to Cumberland, and also community transmission, which means it is spread out in the community, and that is there is not a known link to another confirmed case, not through travel and not through direct contact. So EMS doing what they always do in these type of situations is they are doing the best they can with the resources that they have. Pat?
All right, thanks, Shannon. Still to come.